Hi, hope you guys are all doing fantastic. Welcome to our YouTube channel. In this video, we'll discuss one of the topics which is very important for all healthcare professionals, hypertension. And in the process of today's video, we'll comprehensively discuss various aspects of hypertension through key points. And when I was reviewing literature, when I was going through various standard references, there is a lot of interesting information that I came across, which I'll be presenting in this video. And along with that, one piece of information that really caught my attention is the fact that right now, as we are speaking, around 31% of global population is suffering from hypertension, and that translates to around 1.3 billion people. So what is that we can do as healthcare providers? By accepting this information about hypertension and its management, what is that we can do to society in order to address this issue? And most importantly, what is that we can do to self to help ourselves and to protect ourselves from this deadly disease? Right? So that will be the focus of this video. I hope you guys are ready. Let's go ahead. So first we'll look into normal reference ranges. So according to American Heart Association and according to various standard references available, the following are the normal reference ranges. See, as you know, blood pressure might vary, usually depending upon the physiological status, depending upon the age group, a region we are in, so on and so forth. But the normal ranges are as follows. 120 by 80 is usually considered to be the normal, even though the variations can be there. However, blood pressure is considered to be elevated when the systolic levels are in the range of 120 to 129, as you can see in this table. There is something called as stage 1 and stage 2 hypertension. So stage 1 hypertension is where the systolic levels are in the range of 130 to 139 and diastolic levels are in the range of 80 to 89, right? Either systole or diastole, there could be variation in case of stage 1 hypertension. In case of stage 2 hypertension, the systolic levels are in the range of 140 or more than that, or the diastolic values could be 90 or more than that. And there is something called as hypertensive crisis where the systole is more than 180 mmHg and the diastole levels could be more than 120 mmHg, and treatment is immediately required in such cases, right? So this is some information regarding the normal range. And there is something which we should clearly understand, that these blood pressure values only reflect a mere quantitative changes but not qualitative changes, which means just because if I say that the blood pressure is in the so-called normal range doesn't mean that the person will be immune to cardiovascular diseases or other ailments related to hypertension. So these members do not actually reflect the qualitative changes. That's one thing which I want you to understand. And now, moving on to the next aspect, that is risk factors. What are the various risk factors associated with, towards development of hypertension? There are modifiable risk factors as well as non-modifiable risk factors along with environmental factors. Modifiable risk factors include changes in diet, changes in lifestyle, drinking alcohol or smoking. These are the things which we can modify, right? So these fall under modifiable or modifying risk factors, whereas non-modifiable risk factors include age, genetics, including ethnicity. In fact, studies have shown that people with ethnic backgrounds like Japanese or African Americans, they are having higher chances of developing hypertension, right? So this is some information which we have regarding risk factors. So we have modifiable, non-modifiable, and also environmental risk factors. For example, air pollution. That studies have shown that people living in areas where there is very high levels of air pollution, it's equivalent to drinking or having 10 to 15 or 20 cigarettes per day, right? Depending upon the area you're living in, depending upon the amount of air pollution that is prevalent over there. So these are some of the risk factors for hypertension. And along with that, diagnosis of hypertension. How do you diagnose hypertension? Like you just take a measurement and say the person is hypertensive if the values are above 140 or 90, or is there something else we can do? In fact, WHO clearly states that you need to have two measurements. And when these two measurements are consistent with the ranges which we discussed previously, then you can categorize the person as hypertensive. Or even more accurate, there is something called as ABPM, ambulatory blood pressure monitoring, where it is a continuous monitoring of blood pressure over 24 hours or even more, so that you can come to a more accurate assessment of the blood pressure range, and then you can institute treatment accordingly, right? So this is something which I want you guys to make a note of. And as we discussed the ranges previously, if it is above or equal to 140 by 90 mmHg, then we can consider the patient to be of stage 2 hypertension, right? And the diagnosis is established so that you can go ahead with treatment according, which we'll discuss a bit later. And what are the various symptoms of hypertension? Studies have shown that most people with hypertension, they remain asymptomatic. However, some patients might experience headaches, chest pain, breathlessness, and various other range of symptoms, as you can see on the screen right now. So symptoms, usually asymptomatic, but also there can be certain symptoms experienced by the patients. And if left untreated, these can lead to, eventually there can be end organ damage, right? And moving on to the treatment aspect, one of the primary objectives or goals of treatment of hypertension is to decrease the incidence of cardiovascular events, which is very, very important. And if done properly, if treated properly, there is almost 30% reduction in stroke and 20% reduction in coronary artery disease as per various studies. So treatment is very, very important. And in treatment, we can discuss so many aspects, but first and foremost, I would like to highlight about something called as DASH regimen, DSH, dietary approach to stop hypertension, which is basically a kind of lifestyle change where you're modifying your diet, where the diet is rich with various vegetables, fruits, whole grains, poultry related foodstuffs, fish, and other healthy things, and low in sugary foods or sugary drinks, sugars, red meat, etc. So basically, this DASH regimen is known to reduce the chances of mortality, heart-related issues, obesity, diabetes, so on and so forth. And also there is something called as Mediterranean diet, which is similar to DASH diet, but low in sodium and also rich in garlic and omega-3 fatty acids, which are present in fish. In fact, garlic and omega-3 fatty acids are known to be potent hypotensives. In fact, my mom used to say during my childhood, like, eat more garlic, it's good for heart. Now I understand why. So these are some of the dietary changes which we can make in order to treat as well as prevent hypertension, right? DASH regimen, Mediterranean diet, so on and so forth. And along with that, being more physically active, sitting less, and stopping consumption of alcohol, tobacco, etc. These are some of the things which we can, incorporate in the treatment regimen while dealing with patients of hypertension. And along with that, we also have various medications which are available. Like we have these diuretics, thiazide and thiazide-like drugs. We have ACE inhibitors, angiotensin converting enzyme inhibitors such as enalapril, lisinopril, allprils, etc. And we also have ARBs, angiotensin 2 receptor blockers like candesartan, losartan, telmisartan, etc. The reason I'm smiling is previously during our UG, when we didn't remember the names, we used to just write random names and then add sartans at the end or prills at the end. So, that was really fun. And anyways, along with that, we also have calcium channel blockers, long-acting calcium channel blockers, right? These are indicated as first line of drugs, which we'll discuss again a bit later, right? So there are various treatment modalities available, and the objective for the single most important objective of this treatment is to reduce the chances of cardiovascular events such as coronary artery disease, or it can be stroke, it can be angina, and kidney problems, etc., etc., right? I hope it's clear. And then coming to prevention, again, dietary changes, lifestyle changes, reducing or altogether stopping consumption of tobacco and alcohol, so on and so forth, have been advocated. But two things which I wanted to highlight is number one, sodium intake, number two, exercise. Because WHO has been giving repeated recommendations which most of us are failing to meet. And we personally, as well as when we don't meet the requirements, how can we suggest others to follow the same? According to WHO, the amount of sodium intake per day has to be less than 2 grams. That's what they suggest, right? And the second thing is, again, according to WHO guidelines, every person on this planet should require at least 150 minutes of moderate intensity exercise on a weekly basis, or at least 70 minutes of intense aerobic exercise on a weekly basis. And on top of it, every week, at least 2 or 3 days, or even more than that, do some strength training, weightlifting, whatever it is, whatever suits you, based on your, inclination, right? So these are two things which I wanted to highlight because very recently, a couple of days ago, I came across a news report which suggested that, in fact, I highlighted this in live as well, that almost 20 crore Indians fail to meet this requirement of exercise, and most of us are leading a very passive lifestyle. That's what WHO report states, and this is very alarming because it's like a ticking time bomb, and it's only a matter of time before we as a country develop, you know, diabetes, hypertension, so on and so forth. And for your information, as on today, as per the latest data that's available, around 15% of Indians are hypertensive, around 40% are pre-hypertensives. So you know where we are heading towards. And in order to do well, as an individual and as a society, we should save ourselves from all these lifestyle related diseases. Don't you think so? Now, coming to various complications of diabetes, again, there can be angina, chest pain, there can be heart attack, there can be heart failure, there can be kidney related issues, and irregular heartbeats, diabetes. Most importantly, interestingly, changes in retina, which has been graded from grade 1 to grade 4. In fact, in Davidson, they talk about diabetic retinopathy as well as hypertensive retinopathy. In hypertensive retinopathy, grade 1, silver wiring appearance, where the arterioles, they are thickened, increased tortuosity is evident, and increased reflectiveness, giving this silver wiring appearance. In grade 2, there is arteriovenous nipping. And in grade 3, we talk about these hemorrhages. Because of retinal ischemia, there is blot hemorrhage, cotton wool exudates, flame-shaped hemorrhages, etc. Grade 4, there is papilledema. So these are some of the changes, very important entrance point of view. You can make a note. In fact, I've seen them very personally and very closely as my mom had to go through all these changes. And along with that, there are other complications which are beyond the scope for discussion here. And then coming to prevalence, very interesting, and this is my personal favorite because this allows us to understand the gravity of the problem. As I said in the initial discussion, around 31% of global population is currently, they are hypertensive, which translates to 1.3 billion people. India alone, 15% are hypertensive, around 40% are in pre-hypertensive stage. And in 1975, around 559 or 594 million, that is close to 600 million, were hypertensives. But by the end of 2024, 1.3 billion people are estimated to have hypertension. So you see that mostly in the low income and middle income countries, there has been rapid increase in cases of hypertension. So lifestyle changes, dietary changes have to be incorporated on an immediate basis without any delay. And along that prevalence, this also, while I was going through some other articles and studies, clearly mentioned that in WHO website as well, the prevalence is highest in Africa, around 27%, right? Whereas in Americas, they say it is around 18%. In India, as I said, it's around 14.9 or 15%. Now, coming to first line of agents and combination therapy, with this we can conclude this video. So, as healthcare providers, we need to equip ourselves with not many medicines, to understand their complications as well, and to know when to indicate or when to give a particular medication depending upon the status of the individual. So the first line agents or the first line pharmaceutical agents, according to 2021 latest guidelines provided by WHO, include the following. So as you can see, we have thiazide-like drugs, thiazide or thiazide-like drugs, that is diuretics, which fall under first line agents. Also, we have ACE inhibitor, as I said previously, angiotensin converting enzyme inhibitors like PRILs. They're also first line agents. Also, angiotensin 2 receptor blockers like telmisartan, losartan, etc., also fall under first line agents. Along with that, calcium channel blockers, long acting dihydropyridone calcium channel blockers. These are the first line agents as recommended by WHO. Right? So, along with that, when do we go for combination therapy? In fact, WHO again states that when the baseline blood pressure is more than the target blood pressure, then we have to go for combination therapy. So how much more? If it is more by 20 by 10 mmHg, then we go with combination therapy according to WHO guidelines. And they say that rather than going with two pills, try to combine and then give it in the form of a single pill. Combination of amlodipine and metoprolol, or combination of losartan with metoprolol, right? Single pill regimen, because the complaints will be more. The patient complaints is improved, right? According to WHO and according to observation and common sense. So whenever possible, or whenever you're going for combination therapy, go with single pill regimen to improve patient complaints. So these are some of the key points related to hypertension. So in this process, we have comprehensively discussed various dimensions of hypertension. I hope it's clear. And also in the process, I hope you're making notes. And before I conclude, to summarize all that we have discussed so far, hypertension is something which is quite commonly seen, diagnosed in the current population, in the current global population. And according to the available estimates, right? 31% of global population is suffering from hypertension, and we have given the prevalences, etc., etc. And the intention here in providing this information is not just to institute right treatment to the patients, but also to make some personal changes, because you treat others and you suffer in the process, then what's the point? So first we should take care of ourselves so that we can be strong, so that we can eventually take care of others around us, including our own family members, right? So as we have seen, reference ranges 120/80 is something which is considered to be normal, but the moment you go to a doctor, right? A patient comes to a doctor, there can be white coat hypertension, right? In such cases, ABPM, which I discussed previously, ambulatory blood pressure monitoring, will be helpful to eliminate that bias. Okay, so the reference ranges we have seen, do make sure that you are kind of memorizing these values. These are the latest information that we have according to AHA. And along with that, we have also seen some risk factors like modifiable risk factors, non-modifiable risk factors, environmental risk factors, etc. And the diagnosis of hypertension, we need two measurements, different days, or you can go with ABPM, right? And coming to various symptoms, usually asymptomatic, but if at all there are symptoms, we have seen that there can be headaches, there can be chest pain, there can be breathlessness, dizziness in extreme cases, nosebleeds, etc., as we have discussed previously. And coming to treatment, we try to focus on the lifestyle changes. Apart from the pharmacological intervention. Pharmacological intervention is necessary, but it should be done as a last resort. But before that, if we can institute right lifestyle changes, dietary changes, that's going to be a blessing for the patient. And also, the burden on the healthcare industry is going to come down eventually, right? So the point is, in case of DASH diet, we're talking about low carbs, less sugars, and we're talking about high fruits, vegetables, and even less red meat, as we discussed. And the Mediterranean diet is all about, it's similar to DASH diet, but with low sodium and with high amounts of garlic and omega-3 fatty acids, which is present in fish. So this garlic and omega-3 fatty acid are considered to be potent hypotensives, as we discussed previously. And coming to prevention, we discussed about various modalities. But two things which I wanted to highlight is the salt intake and the amount of exercise that needs to be done as per WHO guidelines, right? Which we are falling short of as a nation, and we should catch up to that. And coming to various complications, we discussed in brief about hypertensive retinopathy and other complications like stroke, heart attacks, angina, kidney failures, etc. And prevalence, we have seen how widely this hypertension is prevalent, not just in India, but on a global level. And also, we have seen various first line agents, various combination therapies using the drugs available in first line agents. Like we have seen diuretics, we have seen about angiotensin 2 receptor blockers, ARBs, we have seen AC inhibitors, angiotensin converting enzyme inhibitors. We've also seen the role of calcium channel blockers. Basically, these drugs, they relax blood vessels and, kind of prevent the patient from developing the complications associated with hypertension, which we can elaborately discuss while dealing with these drugs individually when we go through pharmacology, right? So these are some of the things, these are some of the areas which I wanted to highlight. I hope this video is helpful. And after this video, once the premiere of this video ends, we'll start posting MCQs on the community page of our YouTube channel, right? So I really appreciate your active participation. And one thing which I wanted to highlight is any kind of video which you're observing or which you're watching in our channel, make a habit of taking notes in the process simultaneously, because as I highlighted in the previous video, notes preparation makes hell lot of difference and takes your prep to next level, right? So wish you all the best. Love you all. And if you have any queries or you need any further assistance, you can always get back through mail at proudtobedentist@gmail.com 24/7. Wish you all the best. Love you all.